More new infections as millions of people lose the battle against HIV and AIDS globally. That's the stark warning that came with the release of the latest report by the United Nations, which shows drastic cuts from donors and the US President Donald Trump's decision to withdraw $4.3 billion in funding for HIV programs has triggered a new crisis.
If the world doesn't plug this hole, we estimate that an additional 6 million people will be newly infected in the next 4 years. So we had 1.3 last year, but between now and 2029, we could have another 6 million newly infected, and we could have 4 million additional deaths.
UNAIDS data shows that South Africa has about 7.7 million people living with HIV, the highest number in the world. And its health department says PEPFAR funding that contributed about 17% to its HIV and AIDS program that was used to run HIV counseling and testing campaigns was paused in January.
What we did immediately after PEPFAR pulled out, we sat and looked at the programs and took a decision that no matter what has happened, come what may, people who are on ARVs will continue taking them.
Mbulelo Jasi is one of millions of South Africans living with HIV. He says the funding cuts have left them worried, but they are still soldiering on even though some facilities have closed.
I don't picture myself dying, not this time around, and that's the attitude of people with HIV globally, that this time around governments must also regroup.
But experts say this funding could have a good ending if governments, civil society organizations and communities regroup and strategize by repurposing government funds to prioritize stopping new infections.
With plans now advanced to introduce a long-acting medicine that can prevent HIV infection with a twice-a-year injection and monthly tablets, UNAIDS says the world could be on the verge of a treatment revolution. But for this to materialize, it says, countries must prevent disruption of services, protect supply chains, maintain reach, and deliver quality HIV services. Thuso Khumalo, Africa Matters, Johannesburg, South Africa.